Good day to all. My name is Ria Miluad. For now, I am going to report the different standard first aid, cardiopulmonary resuscitation or CPR, automated external defibrillator or AED. Let us start from the chapter 1. It's all about the first aid. What is first aid? First aid is the immediate help given to a victim of injury or sudden illness by a bystander under appropriate medical help arrives or the victim is seen by a healthcare provider. First aid is generally not all the treatment the persons need, but it helps the victim for the usually short time until advanced care begins. Why learn first aid? First aid training helps save lives. It's that simple. Whether on the job, in your home, or in the community. Knowing first aid allows you to help someone who is injured or suddenly ill until help arrives or the person sees a healthcare provider. These are the goals of the first aid. First, keep the victim alive. Second, prevent the victim's condition from getting worse. Third, help promote recovery from the injury or illness. Last, ensure the victim receives medical. By doing first aid, we must have the first aid kit. Keep a well-stocked first aid kit in your home and vehicle, and know where one is kept at work. Take one with you on activities such as camping and boating. A cell phone is also helpful in most emergencies. Chapter 2. Take action in an emergency. Taking action in all emergencies involving injury or illness, we must always follow the 6 basic steps. Number 1, we have recognize the emergency and check the scene. Number 2, decide to help. Number 3, call the 911. 4, check the victim. 5, give first aid. And lastly, seek medical attention. What is PPE? PPE is any equipment used to protect yourself from contact with blood and body fluids. Most important, keep medical exam gloves in your first aid kit and wear them in most first aid situations. If there is an immediate life-threatening problem such as stopped breathing, the victim needs immediate help in any course of emergency and to keep the victim stay alive. Check the ABCs. A for airway, B for breathing, and C for circulation. Chapter 3. The Basic Life Support. The Basic Life Support or BLS refers to a first aid given to a victim of breathing or heart stops. The BLS is often needed for the victim of heart attack, drowning, choking, or other injuries or conditions that affect the breathing or the heart. Cardiopulmonary resuscitation or CPR. Cardiopulmonary resuscitation or CPR combines rescue breathing with chest compressions to pump the oxygenated blood to vital organs. Give CPR to any victim who is not breathing and has no signs of circulation. Techniques for CPR. CPR alternates giving chest compressions and rescue breath. For a victim of any age, these are the general steps of CPR. First, find the correct hand position on the lower half of the breastbone midway between the nipples. Second, compress the chest quickly and rhythmically at a rate of at least 2 compressions per minute for an adult or child. Third, alternate chest compressions and rescue breath in the correct ratio for an adult or infant or child. Here are the primary CPR differences depending on the victim's age. Chapter 4. Bleeding on wound care. Many injuries cause external and internal bleeding. Bleeding may be minor or life-threatening. In addition to controlling bleeding, first aiders should know how to care different kinds of wounds, and how to apply dressings and bandages. Types of external bleeding: bleeding from injured arteries, bleeding from injured veins, bleeding from capillaries. Cleaning wounds unless the wound is very large or bleeding seriously or the victim has other injuries needing attention. Clean the wound to help prevent infection. Wash your hands first and wear gloves if available. Chapter 5: Shock. Shock is a dangerous condition in which not enough oxygen-rich blood enriching vital organs in the body. The brain, heart, and other organs need the continual supply of oxygen. Anything that happens to our in the body that significantly reduces blood flow can cause shock. Anaphylaxis is a severe allergic reaction, also called anaphylactic shock. It is a life-threatening emergency because the victim's airway may swell, making breathing difficult or impossible. Always call 911 for an anaphylaxis emergency. Chapter 6: Burns. Burns of the skin or deeper tissues may be caused by heat, chemicals, or electricity. Mild heat burns and sunburn may need only simple first aid, but severe burns can be a medical emergency. How bad is burn? First-degree burns, also called superficial burns, damage only the skin's outer layer like a typical sunburn. Second-degree burns, also called partial thickness burns, damage the skin's deeper layers. The third-degree burns, also called full thickness burns, damage the skin all the way through and may burn the muscle or other tissues. Chapter 7: Serious injuries. Many factors affect how serious an injury is. As you have learned, injuries that threaten the victim's airway, breathing, or circulation are life-threatening. Severe bleeding is also very serious and may become life-threatening. Head and spinal injuries. Any injury to the head may also injure the spine. Whenever you find a serious head injury, suspect a neck or back injury also. We have these: skull fractures, brain injuries, and spinal injuries. Chapter 8: Bone, joint, and muscle injuries. Fractures. A fracture is a broken bone. With a closed fracture, the skin is not broken. With an open fracture, there is an open wound at the fracture site, and a bone may protrude through the wound. Do this first. Have the victim rest and immobilize the area. Call 911 or to be transported to the emergency room. With an open fracture, cover the wound with dressing. Put ice or cold pack on the area. Treat the victim for shock. Monitor and remove clothing and jewelry. Joint injuries. Injuries to joints include dislocation and sprains. In a dislocations, one or more bones have been moved out of the normal position in the joint. A sprain is an injury to ligaments and other structures in a joint. Both kinds of joint injuries often look similar to a fracture. Chapter 9: Sudden illness. Heart attack is a sudden reduced blood flow to the heart muscle. It is a medical emergency because it can lead to cardiac arrest. Heart attack can occur at any age. The signs and symptoms of heart attack may considerably, from vague chest discomfort to crushing pain, with or without other symptoms. Angina is a chest pain caused by heart disease that usually happens after intense activity or extensions. The pain usually lasts only a few minutes. People usually know when they have angina and may carry medication for it. Help a person with angina take his or her own medication and rest. Stroke, also called the brain attack, is an interruption of blood flow to a part of the brain, killing nerve cells and affecting the victim's functioning. A stroke victim needs medical help immediately to decrease the chance of permanent damage. Here are the general care for sudden illness. Call 911 for unexpected sudden illness. Help victim rest and avoid getting chilled or overheated. Reassure the victim. Do not give the victim anything to eat and drink. Watch for changes and be prepared to give basic life support or BLS. Chapter 10, Poisoning. Swallowed poisons, many substances in home and work settings are poisonous if swallowed. Food poisoning. Food poisoning symptoms may begin soon after eating or within a day. Inhaled poisons in work settings, various gases and fumes may be present unless you know the specific treatment for inhaling a gas. Care for a victim of suspected gas inhalation the same as for carbon monoxide. Alcohol abuse. Excessive alcohol consumption causes problems that may lead to the medical emergency. Animal bites cause wounds and carry the risk of rabies, which can be fatal without prompt treatment. Human bites. Because our mouths are full of germs, a bite from a human can cause a wound infection. Chapter 11. Heat and cold emergencies. Cold injuries. Exposure to cold temperature can cause either localized freezing of skin and other tissues, or lowering of the whole body's temperature, or so-called hypothermia. Heat emergencies. Heat illness can result when people become overheated in a hot environment, like heat cramps, heat exhaustion, heat stroke. Rescuing and moving victims. Rescuing a victim. Three common situations involving victim rescue are fires, hazardous materials incidents, and motor vehicles crashes when the vehicle's on fire. Those when there is fire. Remove everyone from the area. Close doors behind you as you leave. Call 911, set off alarms. Use a fire extinguisher to combat a fire. Do not enter an area of flares and smoke in an attempt to rescue others.